you started as a chiropractor and then you went into a specialization which is far beyond chiropractic. Could you share with us a little bit that journey starting with becoming a chiropractor and then?
Yeah, I started more as a composer and a musician and an artist. I actually have a Bachelor of Fine Arts degree. I went to art school. And I got out into the world and had some businesses. And then 9 years later, I went back to school. And I went to chiropractic school not so much to become a chiropractor, but as more of a spiritual journey to find out what's here. That this body is kind of a textbook of universal law. It's a microcosm of esoteric information. And so I wanted to learn anatomy, physiology, biochemistry, kind of the nth degree of what was out there. Actually, I'd never been to a chiropractor when I went to chiropractic school, so think about that one. So, but in the course of that, you get transformed. At some point, the academic is over and clinic begins, and you realize that there's a practical application to all the things that you've been learning. And then in 1980, I graduated and I got into into practice in a large holistic health center. So it was a wonderful environment. The idea was, let's pack as many holistic therapies under one roof as we possibly can, and let's test through all these different body systems in your body. You come to me, I'm going to test through every body system I know to test through, find as many imbalances as possible, and then just go about the business of fixing every single thing we find with a few different methods. And people tend to get well. Because I was still a musician and I put myself through school as a medical illustrator, so that was how I made money as an artist finally, because that's how I studied by drawing and then selling those drawings. So I get into practice. I'm making some serious money for the first time in my life, and all of a sudden it occurs to me that I could do something I've always wanted to do, which is make an album as a composer, as a musician. And I went down and took my first bank loan, bought myself the most sophisticated equipment at the time. Right at that point, electronic keyboards were moving from analog to digital for the first time. So I bought the first digital keyboard, professional recorders and mixing boards, and put it in my spare room. And then my wife at the time wanted me to work on her back. So I popped over my portable table in the spare room, put her on the table, and all of a sudden realized this was a setup. I'm surrounded by sound equipment with somebody on a table. And I'm thinking to myself, I wonder if I could make a chiropractic adjustment with a sound wave, because each vertebra is a different shape, density, and mass, and you should be able to find a fundamental resonant frequency for a single vertebra. And so I set up an experiment to do that. At the time I was using kind of an advanced kinesiology muscle testing, and the idea behind muscle testing is if your vertebra is rotated to the right and the right facet joint is pinched and is causing pain, and the muscles tighten up to hold it so it can't go out any further, and that causes pain, if I start pushing the vertebra in different directions with my finger, if I push it in just the direction it's out, I've just made a bad situation slightly worse. More compression into the joint fires signals to the brain. Bad situation is getting worse down here. And the way the brain is set up is two basic rules. Rule number one is survive at all costs. And there's an elaborate series of mechanisms for initiating a stress response, a fight or flight response, mobilizing my resources to fight for my life if I think my life is threatened. And rule number two is do no self-harm. Don't waste life energy. Get the most work with the least amount of energy expended. So when I push this vertebra in the direction it's out, new signals are firing from this facet that's now already pinched, getting a little more pinched, firing to the brain. When signals fire into the brain from my senses, the brain is evaluating it. Is this good for me? Is this neutral? Is this bad? If it's neutral, I'm not going to waste energy on it, and it disappears out of my field. I call it accommodation. Like I sit down here, I feel my signals from my butt, it's neutral, so my butt disappears until I remember I've got one. So anyway, so this signal is coming, and the brain's going, is this neutral, is this good, or is this bad? It's not neutral, it's not good, it's bad, because it's making a bad situation worse. So essentially, it's a mini version of my life might be threatened, but I don't know yet until I can mobilize my defenses and then take a look. First knee-jerk response, mobilize my defenses. Sympathetic nervous system turns on. Signals my pituitary to signal my adrenal glands to raise my blood pressure, respiration, heart rate. Pulls energy from my gut elimination system, my immune system, my higher brain centers, puts it in my muscle to fight for my life. And all my muscles get weak. Because it's more important to channel energy into my system to fight for my life than it is to see if the muscle this guy is testing is still strong or not, right? So I'm finding a good, strong muscle. When you have this stress response, the brain is forced to divert its attention to a possible threat, and now the muscle is showing some weakness because my attention has been diverted. It's a classic finding of a stress response. That means that I can push on the fifth lumbar in the direction it's out and get a muscle gets weak. That confirms to me there's an active stress response. And while I've got this situation in place, I can put a weight on the middle C key of my keyboard and play this tone. I've pushing on the vertebra in the direction it's out, that makes the strong muscle weak because we're having a stress response. And while that's in place, I'm going to put this weight on the middle C key on my keyboard. Now there's this tone coming out. Nothing happens. So I move it to C sharp. Then I move it to D. And at D, this muscle is starting to regain some of its strength. And then I try D sharp, and it's weak again. So I go back to D, and I start microtuning, because these electronic keyboards happen to be extremely sophisticated tone generators. I can tune between C and C sharp with 100 steps with the digital readout. So I can go D plus 1 cent, plus 2 cents, plus 3 cents, 3 divisions out of 100 of sharp. And so I'll jump at D plus 10, D plus 20, and it's getting stronger. D plus 21, 2, 3, maximum strongness in the muscle. Now, even though I'm pushing and creating an active stress response, I'm neutralizing the stress response with this tone. And the only thing that will neutralize a life-threatening stress response is to give the body what it needs to fix it at the same time, and the two cancel each other out. In other words, the brain is going, I'm receiving a signal that's making a bad situation worse. My life might be threatened. I'm having a full-blown alarm response, but I'm also getting what I need to fix it at the same time, so I don't have to be worried. So the stress response goes away. And I can microtune it to an accuracy of a couple of decimal points. So at that point, I put a speaker on her back and I cranked it up for a few minutes, and afterwards I could go in, push, no response, no pain. She gets up, thank you, that's good, I'm fine. And I realized, whoa, wait a second. That little decision I just made has now completely changed my whole life. This one little tiny decision that I made, logically I'm thinking, it should work, but when it does work, everything's different. I just made an adjustment without touching your body, except with a mechanical energy wave. Sound is a mechanical energy wave. It's not on the electromagnetic spectrum like everything else in the universe. It's the only thing in the universe that is not electromagnetic. Pure energy wave moving through a medium. So basically what I was doing was inputting a pure energy wave into her lower spine at a certain frequency. We call it sound because it's got this little mechanism, but that's only sensitive between 20 and 20,000 hertz. You can go below that and you go above that. Below that you feel as vibration sense. Above that it's other interesting things that we might discuss, but at least I made this first chiropractic adjustment with the sound wave. And I was in this incredible incubator of holistic investigation at this clinic. So I could bring this straight into this clinic and start working on it there. that's when I realized that I could do cranial work, because the cranium is 26 bones all assembled together, and they're supposed to be moving. And when they're stuck, bad things happen in the brain because cerebral spinal fluid doesn't pump properly. And some of those are very difficult to get to. You can't touch them directly. You have to touch adjacent bones and gag reflex areas inside of your mouth, and they're sensitive and tender. So I could target a specific cranial bone with a frequency and cause that cranial bone to go into a floating state of resonance. And the next big inhale, where they all expand, reseats it. So now we can do craniopathy without touching you.
Obviously, you've been duplicating. What you just found out was that it was your wife with her back pain.
Mm-hmm.
Right? You duplicate. Can you tell us about when you started duplicating and getting, again, results? And so what happened then?
So I brought this to the clinic, and I started doing it with patients. And the first thing that I realized was that even though maybe I had invented the ultimate low force technique, my hands aren't touching you, sound waves are touching you. Whether that adjustment, that way of adjusting it as far as pain control or relieving your stress or pain or whatever, wasn't really any better than any other method, except the fact that I probably had zero chance of hurting you. The vertebra didn't hold any longer. It was pretty much just another way of making an adjustment. With craniopathy, it really shined because it was now an easy thing to do cranial work. Then I started exploring, well, wait a second, everything in the body is different density. Why couldn't I do something with your liver or with your kidney? And so we had a blood lab there for doing nutritional studies to find out what kind of nutrition you need based on your blood picture. We were doing work with biomagnetics. And all of these things we were doing there. And as time went on, the sound work was giving better results, easier results. I could stimulate or sedate organs, or glands, or spinal levels, or cranials. I started experimenting with stimulating acupuncture points with sound waves. And then I had this kind of epiphany. The brain is an organ. And if I can prove that I can find a frequency that stimulates your liver, and I can see the liver enzymes on your blood test change, then I've got objective evidence that these sound waves are having some effect on the functioning of your organs and glands. So I'm thinking, okay, let's see if we could find the frequency for the brain, because the epiphany was there's a place in the brain where the program resides, where there is a biological organic intelligence that knows how to grow my body out of 2 cells and differentiate the tissues into everything I am and make it all run on automatic without me thinking about it. So my rational thinking mind, the personality that's talking to you now, is actually not me. It's a tool that this part grew to deal with sociology and conversations, like my hand. It's me, it's part of me, but it's not actually me. Who I am is this intelligence, the kind of thing that gets revealed in a true spiritual or mystical experience, where your normal rational thinking mind melts away, and who's left is some ancient something with a lot of knowledge and feeling connected to the universe. So this idea that there's already a program in there that knows what's wrong with me on all the different levels it could be wrong, and knows what it wants to do about that, but it's being prevented from doing that for some reason. The healing is not coming from me. The healing is coming from inside of you somewhere. And so it's kind of like, that God does the healing and the doctor collects the bill. It's this thing where I'm really the physician's assistant, and your rational thinking mind is the patient. You're dragging your body in, and we're going to form a team to wake up this internal physician program and make it run. So the revelation was, if you have symptoms that are coming from your kidney or from your liver, or your digestive tract, or your low back pain, or whatever it is, it's not their fault. They're only doing what Central Command tells them to do because nobody in the body works autonomously. This is just standard physiology. We all know this. We all learn this in school. So it really means that if you've got a kidney problem, instead of me finding a frequency for your kidney, because the kidney is networked in a very complex way to other systems in your body, it really is a problem in the programming up here. And so if I could find the frequency that would balance the programming up here, it should theoretically send the correct signals down to all the component parts that it controls, because this is the conductor of the orchestra, and everybody has to dance together in a very precise way for me to be healthy. Because as that dance begins to drift, symptoms ensue. So the symptoms are really smoke alarms going off to tell me I've got a fire, and the appropriate treatment is not to remove the batteries from the smoke alarm. Right? So if I've got high blood pressure and you tell me that I have to take this pill the rest of my life to manage my blood pressure, I'm willing to do that so I don't have a stroke or a heart attack, as long as somebody's in the back room trying to figure out why I've got the high blood pressure so we can fix that so I don't have to take the pill anymore. But that's not part of the plan. The plan is never that. The plan is this pill is what you take, that's it. And if that's true, it means that I was born with a congenital lack of medication. That's my problem. I was born without enough pills.
As far as helping people with chronic pain, what kind of results have you had?
At a certain point, the work with sound in that clinic was so astounding, because when I put this to the test and I could find a frequency for the brain and see all the imbalances that I had previously been checking through all the different body systems to fix, I'd see them all go away at the same time with the frequency up here. And that's when I sold my practice and sold my house in 1988, and I moved here to California, where they don't drag you away as some insane person for these kind of ideas, you know. And I set up a full-time research institute and a clinic for exploring those ideas. One thing has led to the over the years, and you know, over the last 22 years, I've been using a system that I helped develop 22 years ago. Is called a real-time heart rate variability system. And without getting into all the technical issues, it takes heart information, the electrical information of your heart, the boom, 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 measures the space between each heartbeat, over 190 heartbeats, adds them all together, divides by 190, and you get the mean space. And then each succeeding heartbeat is someplace within the green zone or the red zone related to that's called the standard deviation. It displays it on a screen. And what is being displayed is your sympathetic, parasympathetic nervous system, the master control system I was just talking about. So in the center of your brain, in the hypothalamus, there are these little organelles in there that control the vagus nerve and the sympathetic chain. And the sympathetic, parasympathetic, vagus nerve is the parasympathetic, and it drives the system. Neurons are in the brainstem. And when I have a fight or flight response, the parasympathetic turns off, the sympathetic turns on by default, and I have all the cascade of events that I described before. And after that event is over, after I've finished running for my life and I got away, then you should push in the clutch again, right? The sympathetic should turn off and go to zero. When I eat my food or if I'm relaxing, parasympathetic turns on and energy streams into my gut and my elimination system, and it works on the food and digests the food. And when that's over, sympathetic turns off and goes back to neutral. This neutral place is called homeostasis. Homeo, within myself, stasis, complete rest. It's the zero stress point for the autonomic nervous system, and the autonomic nervous system is the part of the brain that runs it all on automatic below the hood without me thinking about it. And there's this gold standard medical monitoring device that can see that on a computer screen. But when I first came across it, it was a snapshot, not a moving picture. And I wanted the moving picture. So I worked with one of these companies. They made a real-time system for me, and I beta tested it for 6 years and came up with my own screens that I needed, with the readouts that I needed. And what I specifically wanted to see was the moment of homeostasis. And there's a simple test to tell if your grand biocomputer is working properly or not. It's a clinical test I learned in first year clinic. Take a person's blood pressure, and when you're standing up, blood is being pulled out of your head to your feet. Baroreceptors in your carotid arteries signal the pressure drop and signal an alarm response that kicks your adrenals, kicks your blood pressure up to equalize that. It's called gravity stress. When I lay down on my back, no more gravity stress. Easiest to pump the blood on a horizontal plane. So the blood pressure should drop down to baseline to its lowest within 3 minutes. If it doesn't, we have clinical findings. Persistence of a stress response. In this case, I don't need to look at the blood pressure anymore because I've got a device that can look further up the headwaters and see who tells blood pressure what to do. And that's the autonomic nervous system on my computer screen. So now when you lay down, I should see the sympathetic tone be a little high, and I should see it collapse down to homeostasis, which would be the blood pressure going to baseline, within 3 minutes. So what I see with patients, I've been doing this now for 22 years, thousands and thousands of patient visits with this system. In all that time, I've seen a handful of people with a normal nervous system. Granted, people are coming to a doctor's office because they got a problem, but this is kind of beyond statistics. I could bet you we could pull random people off the street and 9 out of 10 would have an abnormally functioning nervous system where they're running a stress response all the time. So I lay you down, the sympathetic is on, I'm expecting it to collapse down to homeostasis within 3 minutes, and it doesn't, it stays there. It's not moving. 3 minutes, 5 minutes, 10 minutes, it's not going anywhere, it's stuck there. That means persistent sympathetic tone, runaway reaction of adrenal glands, burning up all my resources in my body, year after year, decade after decade. You just can't do that. You can't race your engine forever without blowing a gasket. And in the Western world, the gaskets that we blow are stroke and heart attack. Meantime, because we're running a fight or flight response all the time, the first thing to fall is my ability to sleep. We have an epidemic of insomnia in the Western world. And why? Because stages of sleep, when I first drop off to sleep onto alpha, people in sleep research report, I wasn't asleep, but I wasn't awake either. It's a mental buffer zone. I get into theta sleep and start dreaming. That's where my emotions get worked on, because dreams are, you're running for the boogeyman, or you're having a love affair, and it all seems very real. And then down in delta sleep, where I'm the deepest asleep I'm going to be, the most difficult to wake up, where my blood pressure, respiration, heart rate, metabolic processes are at their lowest. That's when the physical body recuperates for the next day. And that's the part of sleep that gets cut out. Because when I'm running a fight or flight response, I need to sleep with one eye open because I think my life is being threatened, and I will not allow myself to go into the most vulnerable portion of sleep where it's most difficult to wake up. So all of my research and my treatments for chronic insomnia all have to do with bringing your brain waves down into a delta state to make that happen again.
So the people who come to see you are people with what conditions? I mean, pain obviously is one of them.
It's a good question. You know, people ask me, what can you treat with this kind of system? And my answer to that is anything that has a stress-related cause. And in my book, that's everything. Because the more I've been in practice, practiced for 37 years now, I'm completely convinced now that stress is the ultimate cause of disease. How my system is handling the stresses that come at it. How intact is my stress handling system. And I can see that on the computer screen. So here's my innovation. You're stuck there. Sympathetic is on, it's not going anywhere. I'm going to pretend, even though this is not a perfect analogy, I'm going to pretend that your autonomic nervous system is a wine glass. And I'm an opera singer. I want to sing the right note that makes the wine glass vibrate. So normally how I'm going to find out what note to sing is ping the wine glass, listen to that note, sing that note, and it will vibrate sympathetic resonance. That's direct resonance. If I sing any octave of that note, which is 1/2 the frequency or double the frequency, it vibrates. That's octave resonance. If I sing any harmonic 3rd, 5th, 7th, 9th, 13th, a harmonic, it'll vibrate. That's harmonic resonance. And kind of everything in the universe is based on those rules, those mathematical proportional rules. So now, I can't ping you, so I don't know what. So when I went through this in my head, if I couldn't ping the wine glass, how could I figure out what it is? I could use my voice as a sweep generator, and I could sweep every frequency with my voice. Oh, and as I get within the sweet spot for the glass, it'll start to respond. And if I'm a scientist, I'll hook that glass up to some sensors and watch my computer screen and watch that glass hit its peak top resonant frequency and know which frequency to use. And I wouldn't use my voice, I'd use a sine wave or something, some mathematical man-made tone with no harmonics that's precise to a couple of decimal points, right? So I made a computer sound sweep with a sine wave and made a special table, like what I'm sitting on here, which has big low frequency transducers in the table. So now I'm laying on top of a big speaker, and the sound waves can come right into my body. And it's a low frequency sweep from 50 hertz up to about 200 for low. And as it's slowly moving, I'm watching your heart rate variability readout. I'm seeing the sympathetic on, I'm watching the sound waves sweep through, and as they're getting to the sweep spot, I'm seeing the stress response beginning to collapse. And as it gets closer and closer and closer, it collapses more and more and more until it hits that point, and I make a cue mark, and now I know what frequency to use. If I play that frequency to the table, this happens. And then there's ramifications that spin out of that, because if I play any octave of that tone, this still happens. But in the body, octaves at the top end of vibration sense in my body, which is about 500 hertz, I feel it in my skin. An octave lower, I feel it in my muscles, different body density. An octave lower, it's tendons, ligaments, discs. An octave lower, it's bone conduction octave. An octave lower, it's a fluid conduction octave. Extracellular fluid, CSF, cardiovascular fluids, lymphatic fluids. So we can cause a streaming effect with low frequency sound waves. We can do a massage in and out of your body. So if you go to a massage therapist, they're going to do various types of therapies to get the pain out of your muscles and make the knots go away. So one is trigger point therapy, which happens in the belly of the muscle, painful knot that you can work out with your fingers. Origin insertion technique. It's the tendons at either side of the muscle. So this biceps muscle attaches here with the tendon, attaches up here with the tendon. One's the origin, one's the insertion. You rub those two and the muscle lets go. And why? Because there's nerve endings inside those tendons called the Golgi tendon apparatus that memorizes this incorrect muscle tension, and you can let that go. There's something called muscle spindle cells, which is the muscle spindles that slide past each other as the muscle contracts, and you can artificially manipulate those to make the muscle relax. So think about this for a second. When you're on the sound table, and I found this frequency that causes zero stress in your entire system, relaxation at the core. Now my nervous system feels like it's in its safe haven place. I can allow myself to take a deep breath. I can go my deepest state of sleep. I can relax everything because I don't have to be like this anymore. And I choose the octave that is the octave that targets muscle tissue. So now it's targeting into all your muscles, but now what we're doing is a trigger point therapy on every square centimeter of every muscle in your whole body all simultaneously. And we're doing the origin and insertion frequencies for the tendons of every single origin and insertion of Golgi tendon apparatus in every single muscle simultaneously. We're doing spindle cell therapy on every single muscle. So in about 5 minutes flat, all of your muscles have completely turned off. And they're no longer in pain. we can go one step further. Let's say you've got a disc problem with your fifth lumbar disc. The problem is the cells that make up the fibroelastic tissue have got a fault line. There's a tear, micro tears. And we need to stimulate those cells so we can now target the octave that targets disc tissue and do some testing to find out what is your fifth lumbar disc tuned to, and then tune the frequencies to that disc and speed the repair. We're boosting the cells. So just like with the wine glass, if I start to sing louder and louder, the wine glass starts to do this thing. And at a certain point, it can't contain its own energy anymore and explodes. But just before that point, the glass is in the highest possible state of resonance it can be in. And when you look at the cells in your body, that's what cells do when they heal. When a cell goes into a healing response, it increases its metabolism, increases its intake of food and expelling of waste and rebuilding of tissue. That means that we can use targeted sound frequencies precisely tuned to boost a super healing response at a cell level.
What kind of results we have to close because of the amount of time?
Yeah.
But what kind of results are you getting? And how do people take that home? Because
the beauty of, well, how they're doing is I've got people flying in from all over the world, so it's astounding. That's why I sold everything and moved to California, because it was so astounding, I couldn't believe really what I was seeing. It's like Star Trek medicine or something. And the beauty of sound is I can do a live recording of the session here on this table and put it on a CD or put it on a digital player, and you can now use it at home. So now I'm empowering you. You'll see, you've got the fifth lumbar problem, you've got the disc problem. And I find a frequency for the disc. I put it on a player, you take it home, and you put the speaker from your home stereo system on your back and crank up the sound. And then there's ramifications that go beyond that. We can target the endorphin producing neurons at each spinal level and wake them up. So anything that is along that dermatome will have no pain. But then there's the Melzack wall gate theory of pain. That's got to do with dermatomes. So depending on where the pain is on your body, there's a dermatome chart that shows which nerves in your spine supply which bands of area. You find which dermatome is associated, and this guy Melzack and Wall, they tapped any place along that dermatome and overloaded the spinal cord tracts with vibration sense and crowded out the pain signals, because vibration sense is 5 times larger surface area than pain, and it has the A fibers, the fast ones, and pain has slow fibers, C ones. That means that now we are overloading the entire posterior of the cord vibration sense tracts with vibration sense, quote, tapping on every square centimeter of your body. So now we've got the ultimate crowding out of pain signals. That's why people have no pain when they're on the table and they get up and it lasts for a while.